Hello everybody, myself Dr. Amolkumar Patil. I am working as a senior consultant urologist and a kidney transplant surgeon and robotic surgeon at Apollo Hospital, Nalundra. See, prostate cancer is something which unfortunately comes without any alarming symptoms, and that's why awareness is very important, because if we detect it early, then we can treat it, or I can say we can cure it. Like many other cancers, it can be completely cured. So why the awareness is important is we need to screen patients, because as I said, typical alarming symptoms of prostate cancer are not there and patient may not find any problem with them. Okay, so some of the patients who are coming for screening, so what it is recommended is normally after 45 years of age, yearly health checkup with a sonography, a urine routine test, a serum PSA, and an examination by a urologist. Examination also includes digital rectal examination. Now, PSA commonly is done in elderly patients when they go to a physician, when they have infection. So, commonest cause of rising PSA is infection and so on. And the last in the list is malignancy. So, PSA is a very important test which needs to be done for prostate cancer. Now, if you detect early prostate cancer on screening, so the chances of disease being localized is very high. So, the treatment will be like cure. How we divide the prostate cancer is for treatment purpose, localized, locally advanced and metastatic. If it is localized, we can give a complete cure by two ways, either a surgery which can be done robotically, and other option is radiotherapy. If it is locally advanced, surgery is still an option depending upon the grade and the we categorize the prostate cancer into different risk categories, and depending upon that, then we take a call whether we require surgery or he needs a radiation or hormone therapy. And if it is a metastatic disease, then mainly hormone therapy. Now, why I am just categorizing the diseases? Screening becomes a pivotal role. That's why this video is basically to make people aware about prostate cancer screening. So, as I said, what does mean by screening? So, yearly health checkup with PSA, urine routine, a sonography and a digital rectal examination by a urologist. Now, if you can do and if you detect the cancer in early stages, when it is localized disease, we can completely cure the cancer. Now, the best available method for treatment is again a robotic radical prostatectomy. Why robotic? In open method, the chances of blood loss are high, the hospital stay is high, a big incision has to be taken, so patient morbidity will increase. More than that, in a localized prostate cancer, where we can give a very good result in continence, urinary continence and in erectile dysfunction, which are the commonest side effects seen in prostatic surgery in an open method. Because in robotically, by doing prostate cancer surgery by robotic method, we have a very good vision, so the nerves can be spared very well, and so the erectile function can be very well maintained. Same thing as we are nicely doing a connection, that is called uretrovesical anastomosis, connecting the urine pipe to the bladder after removing the prostate, which can be done very precisely with a minimal blood loss. So continence rates are high. Continence means leakage of urine can be avoided. And because of deep-seated organ like prostate, robot has definitely helped a lot, and we can give a very good results with robotic prostatectomy. So if it is localized disease, which can be also detected by screening, and then you can get the best benefit of cure. Suppose if you don't do screening and there is a prostate cancer, and over a period of time, when you get the symptoms, because as I said, early prostate cancer don't get symptoms, and delayed, what are the symptoms then? You may get in metastatic disease, you may get bone pain. If it's locally advanced disease, you get some blood in the urine. So, a lot of symptoms are there, but they come in later stage. Early stage, there are no symptoms. That's why screening remains a very important factor in prostate cancer. So I recommend all you people who are above 45 years of age to get prostate cancer screening done. Recently, as September was a prostate cancer awareness month, Apollo Navi Mumbai also had a prostate cancer screening camp, and intermittently we will be also conducting again in the next few months also prostate cancer screening camp. So I request all the people to take the benefit of this. Thank you.